my health things, not specifically for ultrasound data, but for any kind of ultrasound data, and what are the current challenges and what are the new directions that we should also investigate rather than just building solutions for clinical problems as well. So this is a nice paper published in 2020 in European Radiology Journal. And then the title was Implementation of Artificial Intelligence Applications in Radiology. And they basically collected data. This is like an interview. Radiologists, legal consultants, clinical physicists, operational department managers, and data scientists, basically PIs or professors were involved. It was a questionnaire, and they were asked basically what the hindering and facilitating factors of AI in healthcare applications were. So most of the ones that I outlined here, I believe that the performance of AI. So what you get in lab when you're training an AI or deploying an AI in your lab changes a lot when you try to deploy the AI technology in the clinic. There were inconsistent results, so that again decreases. It was mentioned in the interview. Unstructured implementation in the workflow. You can develop an AI method, but if there is not a structured way of incorporating that AI system into the clinical workflow, problems will arise, and then your AI system will either stay in the lab and then wouldn't be used in a clinical setting, which is very important as well. So, and then again, there was like the other challenge was then build evidence. Like in lab environments, we always talk about the accuracy of the AI algorithm or the success rate, but then we don't really investigate how does AI, if it's deployed in a clinical setting, in a hospital setting, how does that change the success of the care given to the patients? Does the treatment of cancer improve using AI methods? Such analysis was missing, and it's seen as one of the hindering factors, which I believe should be investigated more. And again, track to the initial black box of AI. So when the deep learning era, the last basically 7 years, when it very peaked up, we didn't have any idea how this AI was basically being so successful. So the black box of AI was giving basically it was affecting the trust of radiologists, of clinicians to the system now, which basically prompted the development of explainable AI methods where you can really identify what's happening inside the AI, and with that we can overcome the trust issue as well. Factors were seen as basically benefit of AI was basically improved performance in practice, clinical workflow or regular workflow inside the clinical settings or hospital setting, easy integration into the PACS system. She's in this questionnaire by different clinicians and radiologists. And again, local champions were seen as one of the main important factors that are basically playing a major role in deploying AI in healthcare settings. And I'm going to talk briefly more about those as well. So that's why the way I identified is basically these are the main challenges, or like still not challenges, but like more investigations should be done inside the of AI. Data still is problematic, and trust in AI has a big research field, and then FDA approvals, especially for the US and in Canada right now, Canada Health, the guidelines. So AI, how do we get an approval for a software, which is not a medical device? So it's called, because of that, it's called software as a medical device. How does that come into effect? Because it's a very challenging process. So you need to know the steps. And local champions, I'll talk briefly about that and then finish my talk. So workflow integration, as I mentioned as well, AI in healthcare should be need-driven rather than technology-driven. So to achieve this, human-centered design is important. You need to have direct communication with the clinicians and radiologists and determine what exactly the need is inside our hospital settings or clinics. AI should also reduce workflow overload rather than add to it. You cannot develop an AI system that's going to change the workflow, first of all, or add additional time into the workflow. If you were to basically diagnosing a patient without an AI in 10 minutes, if the AI integration adds that and increases that time to 30, 40 minutes, then the deployment AI or acceptance of AI will be very difficult. And again, in different publications, basically data management was seen one of the main difficult in this healthcare feature of healthcare index report done by Philips. And then these are the countries that were basically involved in this. Difficulties with data management was seen as one of the challenges. Lack of data standards across technical systems, different platforms, different countries use different settings. Lack of training on how to utilize digital health technology was seen as another challenge as well. So to overcome some of the challenges, federated learning approaches have been deployed. And what happens is rather than sharing data between hospitals, a model is basically developed and trained on the cloud system. And then you share this model with the hospitals, and then they are trained locally, and then the parameters of the locally trained model are uploaded to the cloud system, and this initial the model here that is in the cloud will be updated through that shared parameters, which improves the model performance on the cloud, and you can again further basically deploy that model locally as well, which is one way of overcoming the data sharing difficulties between hospitals, as well as this can be hospitals in one country as well as hospitals, international hospitals, if they're collaborating on several projects. So federated learning is basically one solution towards that. Another basically problem is the data quantity and quality. As we all know, even if you have a lot of large data sets, sharing these data sets between different also selecting, there are active learning approaches. There are people are looking into, which is basically geared towards selecting only the most informative samples. So rather than trying to label all the data sets, you only label the most informative samples related to the disease, which decreases the labeling process, which is also a very challenging process, especially for medical data, requires lots of time from the clinicians as well. So if there are methods that people are developing to decrease that labeling time, image synthesis, again, as I mentioned, if there's a scarcity in data, basically the quantity GAN approaches, as you have shown with the brain data as well, can be used to increase the data set size and improve the success. And also, most of the AI algorithms are done on retrospective data, as I mentioned as well. You download the data or obtain the data from the hospital, train the algorithm in your local lab setting, but you never close the loop. Once you do that, closing the loop should be prospective studies where you deploy that AI in this hospital setting and really investigate its success. And once that's done, then basically the AI will be deployed and then used in different hospitals. And there's also methods which basically self-supervised or semi-supervised learning approaches where basically use very small data sets, focus on using very small labeled data set rather than labeling millions of data sets, and then improving the accuracy, achieving similar accuracy as supervised learning methods, where you have to label all the data sets available to you. Trust, again, in AI is one of the major challenges, as I mentioned as well. The trust should be an appropriate trust. You cannot over-trust the AI, and if you have under-trust AI, the deployment of that AI will be difficult as well. So you need to develop basically approaches where you can reach or meet the clinicians at this appropriate trust level, where they understand the AI and trust the AI as well to solve. And this can be done
Recording in progress.
Different diseases and diversity in validation